Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith Rogers. Today, as part of our series on vaccines, a look at the Vaccines for Children program. Claire Hannan is the executive director of the Association of Immunization Managers, and she joins the podcast to talk about the CDC program that provides recommended vaccines without charge to about half of the nation's children. Let's listen. Claire Hannan, thanks so much for being on Public Health on Call. How are you today?
I'm good. Thanks for having me.
Sure. So let's start off by, can you tell us a little bit about you and your background and what you do now?
Sure. Well, I am executive director of the Association of Immunization Managers. We are a nonprofit and we have members. Our members are out in the state public health agencies running immunization programs. I have been here for 20 years. So, I have a lot of experience with immunization and vaccine policy and have been just enjoying my career in public health.
Well, then you are absolutely the person to ask about this topic. Today, we're talking about the Vaccines for Children program. So can you give us a little idea? Where did it come from? Who runs it? How does it work? Let's start off with where it came from, how it started.
Sure. Well, back in 1989, 1990, 1991, I was in college. We had measles outbreaks in the United States, and there were tens of thousands of cases, hundreds of deaths. And when the epidemic was investigated, the Centers for Disease Control found that more than half of the children who had measles had not been vaccinated. Even though many of them had a healthcare provider, it was found that the cost of the vaccine was a primary reason for children going unvaccinated. So in 1994, a public governmental program was enacted to provide vaccines free of charge to children who are eligible. So children who are on Medicaid, children who did not have insurance, Alaska natives, Native Americans. And this is actually, the program has actually been serving more than 50% of the nation's children now for 30 years and providing vaccine with their healthcare providers. So enrolling those healthcare providers that are already out there seeing children into the program. And it's administered at the state level. So every state enrolls providers. There's more than 37,000 private physicians and healthcare providers enrolled in the program. They order vaccine. It gets delivered right to their door. And public health works with them closely to ensure that it's stored properly, that kids are screened, that the immunizations are recorded. And it's just been a very, very successful program in making sure that every community has access to kids' vaccines.
And these vaccines are free for families?
They are. They are free of charge for families. Yes.
How do families get enrolled in this program? Or how do physicians, figure out which families are eligible?
Yeah, so physicians, if they're serving Medicaid, kids on Medicaid, those children are automatically eligible. And then they would screen children who come in and check their health insurance to see if the health insurance covers vaccines. Now, we've come a long way in 30 years, so most insurance for children does cover vaccines. But this is a fail-safe, and it provides free vaccine if they self-attest to not having insurance that covers vaccines.
It's really interesting. So the government was responding initially to a massive outbreak of measles and found that cost was a major barrier in immunizing these children. So they implemented a program to take away that barrier. So tell me, do you have an idea of how many children are benefiting from this across the U.S.?
Yeah, so it is over 50% of the children born. In 30 years, CDC estimates that the VFC program has prevented 508 million illnesses, 32 million hospitalizations, and helped avoid over 1 million deaths. So it's just really an incredible program. And it's not one of these government programs where you're waiting in line to get something free or sending something away and waiting for it to come to you. It's the healthcare provider you would go to. And so I think that's the most important really feature of it. It's a private-public partnership, and it really aims at serving kids, families in their communities.
Now, what vaccines does it cover? Is it like all of the pediatric vaccines? How does that work?
It covers all of the vaccines that are recommended by the Advisory Committee on Immunization Practices. The ACIP is sort of the body that sets the recommended schedule for vaccines. And I think there are over 19 illnesses, diseases prevented with the routine vaccines recommended for children by the ACIP.
Now, let's talk a little bit about the context of where we are today, because vaccine hesitancy, you mentioned that cost was a major barrier in getting children vaccinated, which was the impetus of this program. But now we know that, okay, the cost has been more or less mitigated. Vaccine hesitancy might come into play. So how is this program operating in this current context?
Yeah, so 30 years, things have evolved quite a bit. Number one, there are a number of new vaccinations. The most recent one is an immunization that prevents against RSV in infants. So, we've come a long way with new protections. We've also come a long way with communication. And, there is a lot of information, misinformation circulating. It's hard to know. And so this has really evolved from more of a vaccine distribution program to a real whole program where we also educate providers, provide the recommendations to providers, the science around the routine recommendations, so that providers can provide that information to their patients. A provider recommendation goes a long way, and they need to really have the information at hand. So, vaccine confidence, vaccine hesitancy, questions around vaccination, these are all healthy, but, in 1989, right following a measles epidemic, people were really trying to get vaccines. So the program's evolved, and vaccine confidence is definitely one of the areas, educating providers, really making sure that information is accessible, that is credible and reliable for everyone in the program.
So it sounds like in the early days, you maybe had a supply and demand problem as opposed to we have too much supply and not as much demand problem, which may be more of the case now. So a parent brings their child to, for a routine checkup, say like a 24-month checkup for their child. And they say, why is my kid getting so many vaccines? Why is this necessary? And so this program can help equip a physician to have those conversations. Is that correct?
Yes. There is a strong public health infrastructure that provides information, provides the vaccine information statements for the VIS information for patients and providers to understand the vaccine schedule, and really provides information around the science, why a vaccine is recommended, the benefit, the risk, all of the information you need to make a really decision about vaccinating your child.
Now, you said you've been doing this work for 20 some odd years. Tell us about the future outlook for this program and what you hope to see.
Yes, well, 30 years and things are really going well. But I think what we really are looking at, and we now have a lot more capacity with data to know where the providers are located by zip code, what kind of patient base they have, the access points for vaccines. And I think where we're going is to enroll more providers, making sure that we have more access points. I mentioned the most recent immunization against RSV for infants. It's best when it's given within 7 days of birth. And so we're trying to enroll birthing hospitals into the VFC program so that they can provide this life-saving prevention, not only to kids who have insurance, who are covered by insurance in their hospitals, but also to kids who are on Medicaid. So expanding the number of providers in VFC and looking at getting pharmacists enrolled in the VFC. Pharmacists can serve older teens, making sure that they're up to date on vaccinations for adolescents. And so just making sure that we have more and more access points Again, evolving the program as far as providing the education and the science, the information, and also just the number of providers and the access points there.
I was going to ask if there was room for this program to grow. Do you know offhand if there are big gaps that you want to fill, whether they're geographic or maybe by population?
Yeah, I mean, that's something that we talk about a lot with our members. Many of them have done studies looking at rural areas or urban areas or specific pockets where there are low numbers of providers or where their coverage rates are low, where there might be high exemptions from school requirements or other reasons that there's a particular area or community that's vulnerable to an outbreak because their coverage rate aren't as high. And so, so this is happening, and there are certainly many reasons for that. There are rural communities that just don't have enough providers, and that's where we're really looking at pharmacists and other providers that can help. There are urban areas that might not have access points. It's really looking at the data, looking at the providers, looking at the access points, making sure that everybody in every community has a place to go to get the vaccine.
Are there specific vaccines that may have lower uptake than others, whether it's because of availability or whether it's because of maybe misinformation or hesitancy? Like, do you have that data as well?
Yes, we do have that data. And, certainly vaccines that are required for school, their coverage rates are much higher. So measles, polio, HIV, which is, preventing meningitis vaccine, are higher than HPV or flu or COVID. COVID and flu are seasonal. We're really doing everything we can to bring up all of the rates, particularly the ones that are lower, the HPV rates, that's cancer prevention. RSV is newer. So just making sure that we're getting the word out and trying to ensure high coverage rates. But definitely the routine vaccinations, those diseases that have caused problems in the past, like measles, those rates are higher.
My last question is, what do you want people to know about this program? But I think we can break this down a little bit more. What do you want parents to know about this program? Let's start there.
Well, first, I want parents to know the importance of vaccinating their child. Last year, we had 284 cases of measles and 16 outbreaks in the U.S., compared to 59 cases and 4 outbreaks in 2023. So, this is an increasing threat. It's probably not something most parents are concerned about. It's not something they think about. They may not have seen measles. But if we're not vaccinating, if you're not getting your child protected with vaccines, there is a risk. There's a risk to those who are immunocompromised. There's a risk to those who are at schools. So it's just really important to get vaccinated. And you shouldn't have to worry about cost. That's the whole point of the Vaccines for Children program. The cost of the vaccine is not a barrier. You should ask for the vaccines with your routine healthcare provider. They shouldn't have to refer you to a public clinic. That's the whole point of having the Vaccines for Children program. It's all the private providers, the healthcare providers. Now we're looking at birthing hospitals with pharmacies, getting any provider that can provide vaccine into the program so that you can get vaccine, hopefully nearly anywhere, right, where you can get healthcare for your child. So it's just so important to make sure that your child is up to date and protected. And the cost is not a barrier. You don't need to worry about cost. You can ask about VFC vaccine. You can get vaccine at so many different places. It's just so important to make sure your child is up to date.
And let's broaden this out a little bit. What do you think is important for maybe people in the public health field to understand about this program where, maybe they're a public health practitioner, but vaccines is not maybe their specialty? What should they know?
Right. So, of course, we need all healthcare providers to be participating in the program. There can be challenges. It does require enrollment. It does require signing a contract. It does require having the right level of refrigeration, all of those types of things. But public health can help. So any healthcare provider, we definitely want enrolled in the program. And for public health, it's just really critically important to keep promoting VFC, to keep providing accurate information, to really keep that relationship with these providers, partnering with them, partnering with communities, listening to communities, talking with them, showing the benefits and walking through the risks of vaccination. These are all just important pieces of the program. What started as a vaccine distribution program, which is highly efficient and highly successful now, we need to make sure we're keeping all of the aspects of the program moving forward.
This is a phenomenal conversation and program. I mean, you have something that started with a measles outbreak and cost was a barrier, got rid of that. Now misinformation might be a barrier. It's addressing that. And you also have all the data to tell us, where the gaps are and what can be done. Claire Hannan, thank you so much for talking with us about vaccines for children.
Sure. Thank you so much for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Cesiri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.